Imagine waking up at 3 in the morning because your leg has gone completely numb, not tingling, numb. You swing it off the side of the bed and it just hangs there like dead weight, cold to the touch, and for a terrifying few seconds, you cannot feel it at all. That is not a cramp. That is not just sleeping in the wrong position. And if you are over the age of 60, that sensation could be your body sending you a warning it has been trying to send for years. Right now, more than 8 million Americans over the age of 60 are living with a condition called peripheral artery disease, and the majority of them have no idea because they have been told that cold feet, heavy legs, and tingling are just a normal part of getting older. They are not normal. They are a signal, and the most dangerous thing you can do is keep ignoring them. In the next few minutes, I am going to show you the single most powerful exercise for restoring poor leg circulation after 60. What it is, exactly how to do it, why it works at the physiological level, and why your doctor may have never mentioned it to you. Here's what most people do not realize. Poor leg circulation is not just about discomfort. It is about what is happening silently inside your arteries, your capillary beds, and the very tissues that keep your legs functional and alive. When circulation slows in the lower extremities, and after 60, it slows for almost everyone to some degree, you are not just dealing with an inconvenience. You are dealing with a progressive reduction in oxygen delivery to your muscles, your skin, and your nerves. And over time, that oxygen debt accumulates. The mainstream advice is usually simple. Walk more, elevate your legs, maybe take a baby aspirin. And while those things have their place, they do not address the real mechanical and vascular problem happening in the deeper arterial walls and venous valves of your legs. What is actually being damaged is a system called the skeletal muscle pump, the natural mechanism your leg muscles use to push blood back up toward your heart against gravity. After 60, this pump weakens significantly, especially if you have spent years sitting for long periods, and the result is blood that pools, pressure that builds, and veins that slowly lose their structural integrity. And here's the part that should genuinely concern you. When that pump fails, it is not just your legs at risk. Poor venous return increases the workload on your heart, raises your risk of deep vein thrombosis, which is a potentially fatal blood clot, and accelerates the progression of nerve damage in the feet that leads to dangerous falls. My name is Dr. Marcus Ellison, and I have spent more than 28 years working with adults over 60 in vascular health and rehabilitation medicine. I have watched patients come into my office with legs so swollen they could not get their shoes on. I have had patients tell me their previous doctors told them it was just water retention, just aging, just something to manage. And then I have watched those same patients, after learning one specific technique, walk out of my office months later with a quality of life they thought was gone forever. I am sharing this today because I have sat across from too many people who looked at me and asked why nobody warned them sooner. I am done staying quiet when the information exists to genuinely change lives. You deserve to know this. Everything I share here is grounded in real medical research, explained in a way you can actually use starting today. No equipment required, no gym membership, no medication. Today, you will learn exactly which single exercise activates the deep vascular pump in your legs and why it works when walking alone does not. The precise technique that maximizes blood flow return to your heart and reduces dangerous pooling in your lower limbs, and the common mistakes most people make when trying this exercise that cancel out all of its benefits. Stay with me through all of it, because the mistake section alone could change everything for you. The exercise is called the Progressive Ankle Pump and Calf Raise Protocol, and before you think, I have heard of ankle pumps, I have tried those, I want you to keep listening. Because what most people do is a diluted, incomplete version of this exercise that produces minimal results. The full protocol is dramatically different, and the science behind why it works is something you need to understand before you begin. Here is what is actually happening inside your legs when circulation fails. Your calf muscles, specifically the gastrocnemius and the soleus, serve as what cardiovascular researchers call the peripheral heart. A study published in the Journal of Applied Physiology confirmed that rhythmic contraction of the calf muscle group generates enough intramuscular pressure to actively propel venous blood upward through the deep venous system against gravity and into the femoral vein and eventually back to the right side of your heart. Think of it like a squeeze bottle. When the calf muscle contracts, it compresses the deep veins running through it, and that compression pushes the blood inside them upward. When the muscle relaxes, the vein refills from below. The valves inside the veins, tiny flap-like structures, prevent the blood from flowing back down. So every time your calf contracts, you are literally pumping blood toward your heart. Now here is why this matters so intensely after the age of 60. Those venous valves I just mentioned, they weaken with age. A compound called Ellison, which keeps vein walls flexible and those valves snapping shut properly, degrades at an accelerating rate after the 6th decade of life. When the valves become incompetent, that is the medical term, blood begins to leak backward, pool in the lower leg, and create the swelling, heaviness, aching, and discoloration many of you experience every single day. The only way to compensate for weakened valves is to increase the frequency and force of the muscular pump itself. And the progressive ankle pump protocol is specifically designed to do exactly that. I once treated a 67-year-old retired school teacher named Carol who came to see me after her GP had dismissed her leg complaints for 3 consecutive years. She had been told her symptoms, heavy legs by midday, visible purple veining along her calves, and a persistent aching that kept her awake at night, were simply varicose veins and age-related fluid retention. Carol was not sleeping. She had stopped walking distances because the pain became unbearable after about 15 minutes. She had stopped traveling because long flights terrified her. She told me she felt like she was slowly losing access to her own life. When I assessed her, her ankle brachial index, a measure of arterial blood flow, was borderline, and her venous reflux study showed significant valve insufficiency in both calves. She was not a surgical candidate, but she was a perfect candidate for what I am about to teach you. Within 6 weeks of performing this protocol twice daily, Carol's leg swelling had reduced measurably. Within 4 months, she had walked a full mile without stopping for the first time in 3 years. She told me, and I will never forget this, she said, "I feel like I got my legs back." That is not an exaggeration. That is what this exercise is capable of when done correctly. Stop right now and honestly think, how often in a typical day are you completely sedentary, sitting or lying down for more than 90 minutes at a stretch? Comment that number, how many hours a day you spend sitting, in the comments below. I want to understand what you are working with. Now let me give you the exact protocol, step by step. Phase 1 is the ankle pump. Begin seated in a firm chair with your feet flat on the floor. Slowly flex both feet upward so your toes point toward the ceiling as far as is comfortable. This is called dorsiflexion. Hold for 2 full seconds. You should feel a gentle stretch in your shins. Then slowly point your toes downward toward the floor. Plantar flexion, pressing the ball of your foot into the ground firmly. Hold for 2 full seconds. That is 1 complete pump. The key word is slowly. Many people rush this. Rushing eliminates the sustained compression your veins need to respond effectively. Each cycle should take a minimum of 4 full seconds. Perform 20 repetitions, rest for 30 seconds, then repeat. Phase 2 is the standing calf raise. This is where the protocol moves beyond what most people know. Stand behind a sturdy chair and rest your hands lightly on the back for balance, not to hold your weight, just for steadiness. Feet hip-width apart, toes pointing forward. Slowly rise onto the balls of your feet, lifting your heels as high as they will go. Hold at the top for a full 3 seconds. This sustained contraction at peak height is critical. Research from the University of Exeter showed that sustained peak contraction produces significantly greater venous return than quick repetitive raises. Then lower your heels slowly. Take 3 full seconds to come down until your heels are flat on the floor. That lowering phase is called the eccentric contraction, and it activates the soleus muscle, which runs deeper than the gastrocnemius and is actually the more powerful venous pump of the two. Perform 15 of these standing raises. Rest 60 seconds. Repeat for 3 total sets. Phase 3 is the elevation finish. Immediately after your third set of calf raises, lie on your back on a couch or bed and elevate both legs at a 30-degree angle, propped on 2 firm pillows. Remain in this position for 10 full minutes. Do not skip this phase. The elevation assists your now activated muscular pump in draining the residual pooled blood from your lower legs, and it allows your capillary beds to reperfuse with freshly oxygenated blood. Studies from the vascular surgery literature consistently show that post-exercise elevation combined with active pumping produces superior outcomes to either intervention alone. The fix is not complicated. Phase 1, Phase 2, Phase 3. Ankle pump seated, calf raises standing, elevation to finish. Done in that exact order, twice daily, once in the morning before you begin your day, and once in the late afternoon before your swelling typically peaks. That is the full protocol. Now we come to the part that could be the most important thing you hear today, because I have seen patients perform some version of this exercise for months and experience almost no benefit, not because the exercise does not work, but because of specific errors that functionally neutralize it. Mistake number 1 is performing the exercise too quickly. The speed of the movement is not incidental. It is the mechanism. Slow, sustained contraction creates sustained intramuscular pressure. Fast, bouncy repetitions create momentary spikes of pressure that do not generate meaningful venous propulsion. If you can do 20 ankle pumps in 15 seconds, you are doing them wrong. 20 ankle pumps should take at least 90 seconds. Mistake number 2 is stopping after the ankle pumps and skipping the calf raises. The ankle pump activates the distal portion of the venous system, the small veins of the foot and ankle. The standing calf raise activates the deep venous system of the calf, the popliteal and femoral veins, which are the main highways for blood returning to your heart. You need both. One without the other is incomplete therapy. Mistake number 3 is performing the exercise while dehydrated. Blood viscosity, its thickness, increases dramatically when you are dehydrated. A thicker blood requires significantly more muscular force to propel upward. A study published in the American Journal of Clinical Nutrition found that even mild dehydration, just 1.5% of body weight, measurably increased blood viscosity in adults over 60. Drink at least 1 full glass of water before beginning this protocol every time. Mistake number 4 is wearing compression socks incorrectly. Many people have been advised to wear compression stockings, which is excellent advice, but wearing them after the swelling has already built up in the evening dramatically reduces their effectiveness. Compression socks work by preventing pooling, not by reversing it. Put them on first thing in the morning before you stand up. The moment you stand and gravity begins acting on your venous system is the moment compression should already be in place. Mistake number 5 is doing this once and expecting lasting results. I say this with tremendous compassion because I understand how discouraging it is to invest effort into your health and not see immediate results. Venous health is rehabilitative, not instantaneous. The research is clear that meaningful improvement in venous return and reduction in chronic edema requires consistent daily practice for a minimum of 3 to 4 weeks before you will notice significant change. Be patient with your body. It is doing the work. You just have to keep showing up. Stop right now and honestly think, which one of these 5 mistakes have you been making? Just one word in the comments. I see the comment section. I read it. Your answer helps me understand what to address in future videos for you specifically. Now I want to paint a picture of what is actually happening inside your legs when you commit to this protocol for 30 days, because understanding the physiological reward may be the most motivating thing I can offer you. In the first week, you are primarily re-educating the neuromuscular pathways that govern calf contraction. Many adults over 60 have subtle denervation, a partial disconnect between nerve signals and muscle fibers. from decades of sedentary patterns. The early sessions begin reactivating those pathways. You may not feel much different yet, but the communication is being restored. By week 2, you will likely notice that your legs feel slightly less heavy in the afternoon. This is because you have begun to reduce the baseline volume of pooled interstitial fluid, the fluid that leaks out of your capillary walls when venous pressure is chronically elevated. A compound called vascular endothelial growth factor, or VEGF, begins to increase in response to your exercise-induced blood flow changes, promoting the growth of new capillary beds in your calf tissue, what researchers call angiogenesis, new blood vessels. That is extraordinary. Your body is literally building new infrastructure. By weeks 3 and 4, the soleus and gastrocnemius muscles will have measurably increased in both strength and endurance capacity. The sustained 3-second peak contractions you have been performing stimulate slow-twitch type 1 muscle fibers, the ones specifically responsible for postural endurance and venous pumping. A research review in the European Journal of Applied Physiology confirmed that targeted calf training in older adults significantly improved venous emptying rates, the speed at which blood clears from the lower leg, within 4 weeks of consistent practice. And there is one more benefit that I consider just as important as the vascular changes. The ankle and calf complex is the single most important stabilizing mechanism in your lower body for preventing falls. Every time you perform a standing calf raise, you are training the proprioceptive sensors in your ankle joints, the tiny sensory organs called Golgi tendon organs and muscle spindles, that tell your brain where your feet are in space. Falls in adults over 60 are not random. They are the predictable result of declining proprioception. This exercise trains your balance system at the same time it trains your vascular system. 2 life-changing benefits from one 2-minute protocol. Let me bring everything together for you before we close. Today you learned that poor leg circulation after 60 is driven by a weakening of the skeletal muscle pump and deteriorating venous valve function, not just by aging in general. You learned that the progressive ankle pump and calf raise protocol, performed in 3 specific phases, seated, standing, and elevated, directly targets and rehabilitates that pump mechanism. You learned that slow, sustained contraction is the mechanism, and that rushing, dehydration, incomplete technique, and impatience are the enemies of your progress. You learned that within 4 weeks of consistent daily practice, real measurable vascular and neuromuscular change is possible, including new capillary growth, improved venous emptying, and enhanced balance. And you heard Carol's story, a 67-year-old woman who was told there was nothing to be done, who reclaimed her ability to walk a full mile, to sleep through the night, to feel the ground beneath her feet again. If you have been living with cold feet, heavy legs, numbness, swelling, or that feeling of your legs simply failing you, it is not too late. The human body has a capacity for recovery that genuinely humbles me after all my years in medicine. I have watched people in their 70s and 80s rebuild vascular function that they thought was irretrievably gone. The body wants to heal. Your job is simply to give it the right signal. Think about what it would mean to walk through your neighborhood without dreading the ache that follows. To stand in your kitchen cooking a meal without feeling like the floor is pulling at your legs. To wake up in the morning and swing your feet off the bed and feel them, really feel them, steady and warm and ready to carry you through another full day. That is what this is really about. Not just better circulation, but your independence, your confidence, your ability to show up fully in the life you have built. I want to hear from you. What symptom of poor leg circulation has been affecting your life the most? The heaviness, the swelling, the coldness, the nighttime discomfort. Leave your answer in the comments below. I read every single one, and I mean that. Your experience helps me understand what matters most to the people watching, and it helps me serve you better every single week. Subscribe to this channel. Every week, I share evidence-based health strategies specifically designed for adults over 60, not general wellness advice, but targeted, clinically grounded guidance for where you are right now in your life. If this video helped you, if even one thing clicked for you today, hit the like button. It tells the algorithm to share this with more people who may be sitting right now with numb legs and no idea why. You may not know their names, but your like could reach them. Write the words, "My legs are healing," in the comments below, not as a wish, as a commitment, as a declaration to yourself and to everyone watching that you are choosing to take this seriously starting today. Your commitment may be the thing that inspires someone else to finally begin. And share this video with your partner, your brother or sister, your parent, your neighbor, your friend who keeps mentioning their legs are bothering them. Circulation problems are quiet and slow, and they build for years before they become emergencies. You may never know whose life you protect by sharing this today, but you will know you tried. This is Dr. Marcus Ellison. Take care of your legs. They have carried you everywhere you have ever been, and with the right care, they will carry you everywhere you still want to go.